test legal for this particular kind of, well, I think we need the lights up for this one, don't we?
It's an X-ray habit.
Because we're working with the actual rather than virtual, so I'm not projecting anything, so better have all the lights up all the way. I will show one and then say, in terms of what's test legal for this particular one, which one and how do you know? And then you'd have to know whether you have to state a range or an individual one. So take a look at this, and the question is, what are you looking at here, and then how do you know, but don't say anything right away. Wait until everybody has seen it.
Oh. What is this?
Well, that's what I'm asking you.
Oh, this must be a C1.
I will comment in a moment. Has everyone seen it?
Yes.
Okay, what do I have here?
C1.
Yes, it's cervical. It is cervical. How do you know that?
Well, transverse
It
foramen.
has a transverse foramen.
Yeah.
And then, what else can you say about it?
If it's minus processes.
Say again?
If it's minus processes.
Yeah, and then, what else?
The large.
Now, it falls into a particular range. So in which range does this one fall?
3 to 5.
I'll show you
Yeah,
later where
3
they
to
are.
5 is correct. How do you know that? Well, now you have to look closely to see this. After I demonstrate it, you
92.
can handle it. Look more closely. A large but not the largest posterior tubercle and a small anterior tubercle.
Can you show me that?
Yeah. A large but not the largest posterior tubercle and a small anterior tubercle. See
Okay.
that?
Thank you.
A large but not the largest posterior tubercle and a small anterior tubercle. See? A large but not the largest posterior tubercle and a small anterior tubercle. See? A large but not the largest posterior tubercle and a small anterior tubercle. And then notice the large triangular vertebral foramen and the small wide oval body. And then what's sticking up over here? Yeah, that's a craniolateral lip of Luschka.
Ooh.
You see that? Right there. So that means each of these cervical bodies is clasping the sides of the next higher body. You see that?
Yeah.
Which helps stabilize the neck.
92.
Okay. And now let's look at, let's see, let's look at this one. Which one specifically? But don't say anything right away.
Ooh.
Okay, which one?
C1.
Yeah, and what is its proper name? Atlas. The Atlas. And then how do you know it's cervical?
Transverse
It
foramen.
has a transverse foramen. So as soon as you see that, you don't have to think about any other vertebrae. Because everything in the universe, this is true without exception, divides into 2 categories: cervical and not cervical. And this falls into the cervical category. And everything else falls into the not cervical category, including the Atlantic Ocean, the Empire State Building, and the planet Jupiter as well, because none of those have transverse foramen. That's the way things are keyed down. That's the way it's done logically. You make a divide. So you can say cervical and not cervical. Now, if it falls into not cervical, then you have to look for thoracic, lumbar, and sacral characteristics, and then find something that identifies it as one of those. But if it's cervical, then you don't have to think about anything that has to do with thoracic, lumbar, or sacral, or the Empire State Building, or the Atlantic Ocean. Okay, what's that? Don't say anything right away. The posterior tubercle.
Oh.
A ligament attaches to that. By the way, just note, this is visible on the illustration in the handout also. There's also an anterior tubercle. which is not found on the other cervical body, but just on the atlas. And there's a ligament that attaches to that one, too. There's an anterior tubercle. It's an atlas exclusive. See, there's a little tubercle over there. You know, posterior is that way, posterior dorsal, anterior is that way, anterior ventral. So there's the anterior tubercle. So note there's also an anterior tubercle.
What's the ligament's name again? The
The ligament back over here is called the nuchal ligament, or ligamentum nuchae. N-U-C-H-A-L in the anglicized version, or N-U-C-H-A-E in the original Latin version. And that's a median sagittal ligament that attaches to the back of the occipital bone, including the external occipital protuberance. To all of the cervical vertebrae. It goes right through the forks of the ones with bifid spinous processes. And then muscles arise on that, and it ends on C7. Nuchal is another word meaning neck. And then there's an anterior vertebral ligament as well that runs right up the vertebral column. It ends on C1, okay, on the anterior tubercle. And then if you look closely at this, you'll see the reniform superior articular facets. I mean, if you use enough imagination, it'll look like it's kidney-shaped. Reniform means kidney-shaped. See? And so if you see that, that says it's the superior surface. Over here you can see reniform superior articular facets. And then you can see the inferior or caudal articular facets are different. They don't look like the superior ones. So check for that at closer range. That'll require closer range inspection. And then also when you're looking at this at closer range, look in here, and you'll see the facet for articulation with the dens. Just a shallow depression.